The First World War, a devastating conflict that engulfed Europe from 1914 to 1918, had a profound impact on the field of medicine. While the war caused unprecedented destruction and loss of life, it also acted as a catalyst for significant medical advancements. The sheer scale of injuries sustained by soldiers on the battlefield provided surgeons with opportunities to develop and refine new techniques for diagnosis and treatment, leading to lasting improvements in medical practice. The injuries caused by modern warfare were often severe, including complex fractures, deep wounds, and extensive tissue damage. Surgeons, faced with these unprecedented challenges, had to innovate rapidly. The war demanded the development of new surgical techniques that could handle such complexities. For instance, techniques for treating compound fractures and managing infections were improved significantly. The necessity to deal with large numbers of patients under difficult conditions led to the standardization of surgical procedures and the training of more surgeons, which in turn elevated the overall quality of surgery. The war also saw the birth of specialized fields such as orthopedic surgery, driven by the need to treat soldiers with limb injuries. X-rays, discovered in 1895 by Wilhelm Röntgen, had already been used in medical practice before the war. However, the First World War greatly accelerated their development and utility. The war made it clear that reliable and mobile X-ray machines were essential for diagnosing internal injuries, such as shrapnel wounds or fractures that could not be easily detected by external examination alone. The British and French armies, recognizing the importance of this technology, developed mobile X-ray units that could be brought closer to the front lines. These units were vital in helping surgeons locate bullets and shrapnel, which in turn allowed for more precise and less invasive surgeries. The war also led to improvements in the quality and reliability of X-ray images, as well as the safety protocols for both patients and operators. One of the most significant medical challenges during the war was managing blood loss. Soldiers often died from hemorrhage before they could receive medical treatment. The war accelerated research into blood transfusion, leading to breakthroughs that would save countless lives. Prior to the war, blood transfusions were risky and often fatal due to issues like clotting and blood type incompatibility. However, the need for large-scale blood transfusions during the war led to the discovery of methods to prevent clotting, such as adding anticoagulants like sodium citrate to the blood. Additionally, the identification of different blood types by Karl Landsteiner in 1901 became critically important, as it allowed for safer transfusions by matching donors and recipients correctly. The establishment of the first blood banks towards the end of the war marked a turning point in emergency medicine, making transfusions more accessible and reliable. The war also accelerated the development of plastic surgery, a field that was in its infancy at the time. The widespread use of heavy artillery and shrapnel caused horrific facial injuries that were not only life-threatening but also socially devastating for the soldiers who survived them. Dr. Harold Gillies, a pioneering surgeon, recognized the need for specialized treatment for these patients and established the first dedicated plastic surgery unit in 1917. Gillies and his team developed new techniques for reconstructing facial features, including skin grafting and the use of pedicle tubes, which allowed for the transfer of skin and tissue from one part of the body to another. These innovations laid the groundwork for modern plastic surgery, not only helping to restore the appearance of injured soldiers but also improving their psychological well-being. The First World War, despite its horrors, acted as a powerful force for medical innovation. The urgency of treating vast numbers of injured soldiers under challenging conditions led to significant advancements in surgery, X-ray technology, blood transfusion, and plastic surgery. These developments not only saved lives during the war but also laid the foundation for modern medical practices that continue to benefit patients today. The war demonstrated the potential for human ingenuity to respond to crisis, turning the necessity of treating wartime injuries into a catalyst for lasting progress in medicine.